Welcome to Historically. I am Rolake Ademiju. World Hepatitis Day takes place every year on July 28th, bringing the world together to raise awareness of viral hepatitis, its global burden, and to influence real change. World Hepatitis Day is observed on the birthday of Dr. Baruch Blumberg, the Nobel Prize-winning scientist who discovered the hepatitis B virus in 1967 and developed the first hepatitis B vaccine. An average of 1.3 million people lose their lives to hepatitis each year. Instructively, new data from the World Health Organization shows the number of deaths from hepatitis is rising. It is now the world's deadliest virus after COVID-19, and more than 300 million people are living with it. With only 6 years left to meet the global goal of eliminating hepatitis by 2030, it is unfortunate that we are moving backwards rather than making progress. Every year, World Hepatitis Day is celebrated on July 28 to create awareness and educate people about the effects of the viral hepatitis, which can cause liver inflammation, leading to severe liver-related ailments and liver cancer. These days, a team of the WHO expert scientists and policymakers of a few countries are dealing with the upsurge of anonymous acute hepatitis and putting their efforts into understanding the cause of this infection, which is affecting mainly children. There are indications that this infection is not due to the existing 5 known hepatitis viruses: hepatitis A, B, C, D, and E. Most acute hepatitis infections cause mild illness and sometimes go undetected. But sometimes it raises fulminant liver disease and can be fatal. Further, it may require liver transplant. Globally, the primary focus is to eliminate hepatitis B, C, and D infections. Unlike acute viral hepatitis, these 3 infections cause chronic hepatitis that lasts for several years and culminates in more than 1 million deaths per year from cirrhosis and cancer of the liver. These 3 chronic hepatitis infections are responsible for more than 75% of hepatitis mortality worldwide. Though we have the guidance and tools to diagnose, treat, and prevent chronic viral hepatitis, these services are often out of reach in communities. On World Hepatitis Day 2025, WHO highlights the need to take necessary steps to scale up the diagnosis, prevention, and treatment of liver disease, thereby achieving hepatitis elimination goal. To achieve this, the WHO urges countries to achieve special goals, reduces new infections of hepatitis B and C by 90%, a 65% reduction in hepatitis-related deaths from cirrhosis and cancer. Make sure that at least 90% of people infected with hepatitis virus are diagnosed. At least 80% of eligible individuals receive appropriate care. Provision of chronic hepatitis B treatment access to all pregnant women and birth vaccines to their infants in order to prevent hepatitis B virus infection. People who indulge in the following activities are at higher risk of hepatitis: sharing needles to take medicine, performing unprotected oral and anal sex, having multiple sex partners, drink a significant amount of alcohol, having poor nutrition, working in an hospital or nursing home, receiving long-term kidney dialysis, travel to areas with poor sanitation. There are many ways to reduce your chances of getting hepatitis. Get vaccines for hepatitis A and B. Use a condom during sex. Do not share needles to take medicine. Maintaining personal hygiene, such as washing hands thoroughly with soap and water. Do not use the personal belongings of an infected person. Be aware while getting tattoos or body piercing. Make sure you are vaccinated when traveling to areas of the world with poor sanitation. Drink bottled water during your travel. And finally, stay safe out there.